Thank you. We're going to dive right in and let's take a look at the state of the cost of care of veterinary medicine and how we're addressing this with our clients currently. Dr. Hauser, what's happening now in terms of educating clients about the cost of care for their pets? What's happening right now today?
So right now today, it's hard to say because every hospital is a little bit different. But what we do know from studies is that cost of care conversations infrequently occur in exam rooms and during exam rooms. And when the topic is introduced, unfortunately, it's introduced in terms of why it's important for the vet to be doing the services and not necessarily the benefit to the pet. And so it's usually introduced when there's a need to have the cost of care conversation. A service or a procedure is imminently in that pet's future. And this is really a missed opportunity. And the reason it's a missed opportunity is because our clients in multiple studies have told us they want to be proactively educated about the cost of care. And by not meeting their needs, we are setting them up to feel guilty and to feel frustrated because they don't ever want to not give their pets what they need. We're setting pets up to not get adequate care. Our veterinary teams suffer because they're put in situations where they have to deal with economic limitations, and that creates moral stress and burnout for them. So this could be easily remedied if we were more proactive about educating clients about the lifetime cost of care. I really believe in working with hospitals as a consultant and doing relief work in addition to my corporate role, that this is not something that does happen very often. And I'm really interested to hear what my colleagues say about this in their hospitals.
Absolutely. Thank you for that. Dr. Fuhrman, can you share what you've experienced since the pandemic? Has anything really changed for you?
A number of things have changed, Amanda. I think most importantly, as everyone knows, increased demand. More and more people coming to veterinary practices. Above and beyond that, I think we've seen a significant increase or improvement in the human-animal bond, probably as a result of people being at home with their pets more. But the connection between people and their pets has resulted in more people seeking more veterinary care, far less price sensitivity. I think people as a whole, even amongst the unemployed, seem to be willing to spend more dollars on their pets, which has been quite an astounding change from what we've seen in prior years. And then we're seeing a lot of first-time pet owners, a lot of millennials who are either single or in couples, are now adopting animals as, to be part of the family. So I think it's really a big shift in the demographics for the veterinary industry.
That's an amazing call out and certainly a big change that we've all seen. Dr. Hechko, what have you seen?
I agree with Dr. Fuhrman. I think that when the pandemic hit, I told my team, just consider every pet an emotional support animal. And so many of our owners have relied on their pets for companionship and interactions when they were isolated. And the most distressing thing for a lot of those pet owners was when they saw their pet sick. And the one thing that we could all control in that situation was giving our pets the gift of good health and supporting them. And I think that's part of why we're seeing such an increase in clients saying yes to services and being interested in coming into the practices, because that bond is greater now than it's ever been.
Amazing. Let's start next with Dr. Hauser. What are your clients demanding to know now that might be different from the past?
I believe that it is more, and remember, I'm not in the exam room as often as Dr. Fuhrman or Hechko, right? So I'm doing a little bit of sleuthing to get these answers. How we communicate with our clients really matters. when it comes to the cost of care. Traditionally, and studies will bear this out, veterinarians talk in terms of tangibles, how much time it takes us to do a procedure, or the special equipment, or the training that we need to have for the procedure. But what clients respond to is understanding the why behind the recommendation. What is the value of that recommendation to them and to their pet? I think another important differentiator is that we do need to understand that there's a difference, and Dr. Fuhrman kind of alluded to it, a difference between the price of care and the cost of care. And the price of care is transactional. And Dr. Fuhrman's not seeing as much of that right now. That's a transactional relationship. It's a fee for service. Whereas with the cost of care, that actually weighs and takes into account what happens if that service or that recommendation is not provided for the pet. What is that potential negative outcome for the client and the pet? So I think that clients really are craving that bonding right now. They're more attached than ever to their pets, as both of my colleagues have mentioned, and they really want to understand why we feel that our recommendations are important. They want to be taken along the path with us. They don't want to be just lobbed to softball.
Excellent. Certainly that's something that I'm seeing with my patients as well. Dr. Fuhrman and Dr. Hechko, what are you seeing? Are you seeing that that desire to be led along a pathway of understanding?
I think absolutely. I think historically the profession has been a very patriarchal model of delivering information, and now we're seeing much more collaboration in the exam room, where clients come in having done their own research, being really prepared for with regard to expectations, having real concerns about what could be going on with the animal. So I think pet owners as a whole have really stepped up to the plate in terms of being more proactive and being more involved in their pets' veterinary care.
I would agree. Our office focuses a lot on the partnership that we have with our pets and their families, and we lead those conversations during team meetings about focusing on that partnership, that we're in this together with our families that bring pets in. And by doing that, it puts that real emotion into it. It's not transactional. It's not something where we're just listing off services because that's the way that it needs to go. It truly comes from a passionate part of those conversations. And I think it's that passion when your teams deliver those recommendations for your patients and explain why those recommendations are being made that really drive home that message and allow clients to then feel that they have that ability to say yes or no, that we're not in it for the financial part of it, that we're truly in it because we're focusing on how it's going to benefit the relationship that pet and that family member has, and the longevity of that pet and the quality of that. And I think that is so important when we have those conversations. Our doctors lead their discussions not by a treatment plan. They lead their discussion with, here's what I'm seeing with your pet today, and here's what I want to do to help your pet feel better, and here's the steps that we have to take to get there, and the answers we're looking to get. And when we share that information, it's very easy for a client to say yes when they understand that.
Excellent. Well, I have to ask one of my favorite questions. What is the status of the data? What data do we have to show that conversations matter? Surely we're collecting something. I'd love to hear more about that piece.
I guess I'll start. Again, going back to that videotaped conversation where it was a communication study, 200 interactions with 20 doctors, they found that the cost of care was only introduced 29% of those conversations. So very few. And of that 29%, 33% of those conversations were instigated by the client who asked about the cost of care. Another interesting statistic is that 49% of pet owners are so uncertain about what it's going to cost to treat their animals, that they ask for an estimate before they ever get a chance to begin to discuss treatment acceptance. So that's half of our clients don't understand what it costs to treat their animals. Other statistics, guys?
Dr.
Well,
Hechko, do you guys have any?
Sorry.
I'll say in our own office, we kind of looked at metrics and statistics over the last 2 years. And one area that we've seen a huge uptick is in preventative care. When we have that conversation about the cost of care and the diseases that we need to be looking for in the future and what those may be, we also have that conversation about trying to identify that earlier in that pet's life to maybe slow things down or improve their quality of life or delay the onset of disease. And we've seen over the last year and a half, particularly, we've seen double the amount of preventative care diagnostics that we've done. Again, we lead with what we're looking for, what we want with those patients, and then we tie that into those treatment plans and estimates. And that gives an owner an option. We've already got them hooked because we've explained to them the value of it. They know why they need to do it for their pet. They know that we want to work with them on it. And then at the end, it's their choice. But it's not that when you do it in the reverse way, I just find that when you lead with that price conversation, they're just looking at the dollars and they tune you out for everything else that's more important.
I would agree with Dr. Hechko. I don't have any statistics per se, but just anecdotally, I would agree in the uptick in preventative medicine and more willingness for pet owners to take action now to prevent future illness and pain and concerns for their pets. So I think that's definitely a huge positive for the profession in general.